Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of The Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at The Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the SafeCamp Audio Network. You can check out our show page and all of SafeCamp's other great podcasts at safecampaudio.org on the web or at SafeCamp Audio on social media. All right, this is the last podcast before a little summer break here at the Imprint. We're going to take a couple of weeks off, hopefully bank a few more guest interviews for you, and be back sometime shortly after Labor Day. A few episodes ago, we did an all youth justice headlines edition. This time, we're going to do a shorter child welfare version of that one. Then I'll do a more complete headlines when we get back in September. Sorry for the erratic execution of the podcast here in August. I've been traveling quite a bit, mostly for work, a little bit of vacation in there as well. This episode is coming to you from Seattle, one of my favorite cities to visit. Highly recommend the Chihuly Museum if you like blown glass art and you're ever in Seattle. It's really one of the best museums in the country. I'm always asking people to give me their favorites, so I'll give you that favorite. Also bring back the Supersonics to the NBA. So what I'm going to do today is basically just only look at some national and some trend headline stuff. I think I'm going to use September's headlines edition of the podcast to really step back and do a more comprehensive review of what was a pretty active summer and spring before it on the federal front. So we'll talk in September about all the actions out of the Trump administration and the Chafee bill that's still kind of sort of moving through Congress. Today, not like we're not going to talk about some things that have to do with the federal action in the Trump administration, but we're just going to not focus on the news they're producing. So there has been a lot of discussion, and rightfully so, as ICE continues an aggressive pace of deportations in America, about what is happening in situations where a parent's expulsion from the country leaves no parent in the United States to care for a child or children. One possible outlet, of course, is the foster care system, and there's understandably concern about that, about the action of a child being left abandoned because their lone parent in the country was deported and ending up in a foster care system that I think at best most people would agree is overcapacity in some ways and certainly not as good as being with your family. So I bring all this up because Chapin Hall went out and interviewed officials from more than a dozen state and local agencies to really learn what they are seeing and trying to suss out, okay, is there this connection between the child welfare system, the domestic child welfare system here, and what's going on with ICE? Now, I'll drop a link in the show notes to their reports, but I'll highlight a few main findings, which I'd put in the category of no, there is not an enormous nexus yet. And I'll tell you why yet. So just bulleting out a few things from Chapin Hall's work here. Officials said they were aware of few, if any, and that's the wording that Chapin Hall used, few, if any, children entering foster care directly after the detention or deportation of a parent. There were some jurisdictions that established a process to ensure that there was information about these cases that flowed up to agency leadership. Others said that had not been put in place. And importantly, none of the jurisdictions, I'm sorry, I don't have it in front of me, but I believe there were 13 state and local jurisdictions where they did some interviews. None of those people reported receiving referrals from ICE or from Customs and Border Patrol at all related to kids that are caught up in deportations. Going back to that first finding, so few, if any, children entering foster care directly after the detention or deportation of a parent. That first finding is somewhat quantitatively backed up by federal data through the AFCARS program, at least going back to 2025, because that's the most recent year that we have some data for. Maybe that will change with what's going on with the Home for Every Child. We'll talk about that in September. What the federal numbers show is a notable percentage increase of entries into foster care that, at least in the federal data, are linked to immigration actions. So in 2025, there were 232 kids who entered foster care as a result of an immigration proceeding. 232. In the previous 2 years, 2024 and 2023, That figure was 156 in 2024 and 146 in 2023. What you can draw from that is, yes, there was a marked increase. Going from 156 to 232. I'm not going to do the math in my head, but that's not a nothing burger in terms of a percent increase. In the grand scheme of 170,000 plus entries into foster care, it's not like that this has become a massive factor in foster care. Now, that said, it is going to be interesting what the 2026 data shows on this one about how many kids entered foster care as a result of immigration and deportation actions, because if that number is going from 232 up to, let's say, 500 or 1,000 or something like that, everybody's going to stand up and take notice of that right away. And they should, because that's certainly something extremely relevant to a lot of people advocating for families on both sides of this issue, on the child welfare side, but also on the immigration side. So I think what the Chapin Hall research shows is that it's not rising up as a noticeable trend to child welfare agencies, and that the majority of these instances that do occur, which is kind of an unknowable number, how many kids every year in America don't have anywhere to live as a result, or people to live with immediately after a deportation. A lot of that is being handled within families so that they are making plans to accommodate if and when that happens. But let's see what those 2026 numbers say. Should be not that long before they come out. Another interesting contribution to the knowledge base of late is a report called State Tracking of Kinship Diversion Can Inform the Field. And that was done by Child Trends, which went out looking to learn from states about their practices in tracking kin diversion, which is also known as hidden foster care. We've written a lot about that at the imprint. Generally describes a situation in which a system is shifting the physical custody of a child without changing the legal custody. So if you think about foster care as legally taking a child into state custody and then putting them somewhere, whether that's with a relative or a non-relative foster parent, or into a residential care facility, these are cases in which the parent retains the custody of the child, but they have agreed to divert a child over to a loved one for a sort of either agreed upon or indeterminate amount of time. So Child Trends took their responses from a 2022 survey that they did about kinship policies and found 17 states that either said they always or sometimes track diversion one way or another, and tried to kind of dive deeper on that topic in those states and learn some more from them. I'm going to, again, link to in the show notes, anybody that wants to read more of what they found. But top line was that 11 states reported that their data systems can distinguish between diversion arrangements or hidden foster care and placements where the agency takes custody of the child. And in 3 of the states, those diversion arrangements are nested within bigger categories of alternative arrangements that the agency's made. And then in other states, the diversion cases become discernible or identifiable in tracking because, and I think Colorado is an example that kind of lifted up here, because if the case ends up with a formal removal eventually, and the kid ends up coming into foster care, the case itself changes in status. And so you can see it and differentiate that from a case where a child is not living at home. So first, I just think it's good that we're starting to get more and more information about state practices here, because I do think that this is the next thing in terms of how oversight exists in the child welfare space. It is increasingly, and this is not a judgment on any one state, because I think everybody was more comfortable in the past than they are now with this sort of just existing in between family support and foster care. But it's increasingly ridiculous that we don't have an answer. The number of kids in foster care formally has been going down for years and years now, really since 2018. So we're almost at a decade of pretty significant steady declines in the number of kids who are in foster care. And I think the honest answer is we generally don't know how many of those kids are actually being kept with their parents as opposed to diverted to kin or other family friends and dealt with outside of the system. And that's not a bad thing in and of itself, although there are people with very serious concerns about the way that's done. But it is increasingly ridiculous to not know the answer or to not have the wherewithal to try it and identify it. So Child Trends highlights a few recommendations for training and technical assistance. I noticed went away from making policy recommendations and just listed potential actions. And one of them that I think that they put out there that I think gets to the heart of this discussion as we move past not just how to track this and whether people do track this is should it exist or not and how. And what Child Trends put out there as a potential action is, I'm just going to read from what they wrote. Designate kinship diversion as a distinct case type or service category in administrative data systems with required fields to improve data quality for monitoring, research, and evaluation purposes. And I think what they're saying there as a potential action that states could do is to just take this essentially out of the dark, which is the sort of implication of calling it hidden foster care, and say this is essentially a third way that we have a program preserving families and actually keeping them together. We have foster care when we feel the need to take physical custody of a kid and put them where we want within a more structured and licensed system. And then we have this middle ground where we are doing these plans. And I think that on the one hand, that is what's happening in a lot of states already. So it's not really doing anything new. It's just calling it what it is. And I think there will, on the other hand, be some kinship advocates. I can think of a couple off the top of my head who feel very strongly that while there should be some ability to empower kin to dictate the arrangements with which they step in and help child welfare agencies on their terms, it isn't a good thing, I think, in some people's minds, to have this system that would permit the use of relatives without the structural supports that foster care offers. So I think it's a really important contribution. I'm glad they put this report out to keep this conversation going. And finally, on the macro learning front, I'm going to link to the imprint's Michael Fitzgerald's writing on a report by the U.S. Department of Health and Human Services Office of Inspector General, not where we usually get research from, that sought to identify just how many kids in foster care across the country are living in questionable emergency placements, things like hotel rooms, unsupervised offices, even in cars in some cases, including some that we've reported on here at the imprint. So the IG got answers from more states than I would have guessed. They got the answers from 34 of them and plotted all those placements between January of 2022 and June of 2023. And that map of the 15,000 plus placements that occurred, which, by the way, involve a lot of kids more than once. So it's 15,000 plus total placements, but less kids than that. What it shows is an erratic status quo. And just by way of example, I looked at the most populous states that we have. So it's California, Texas, Florida, New York, and Pennsylvania, I believe in that order. California documented in that time period, that 22 to 23 time period, 398 kids living in questionable placements. Texas had 3,923. Florida had 136. New York didn't tell the Inspector General, could not tell them. And Pennsylvania also could not tell them. So you just I think that just speaks to the mishmash of information available, and also to the fact that it's not like population is solely going to be predictive of how many kids end up in this system, because California and Texas's systems are relatively similar sized. And you might guess, just from the circumstances of child welfare practice, that Texas, with a pretty centralized system, might have less kids in that situation, just based on the fact that they have a very low entry rate into foster care. But as you see, what the reality is, they have many multiples times more kids in these situations than California does. California is more regulatory of where kids are allowed to be in their system, even though they are a county-led system. There is a lot of state oversight on that. And then you look at New York and Pennsylvania, who have very county-strong child welfare systems and didn't produce an answer, but that's not in and of itself the explanation, because California was able to. Just reading from Michael's piece here about stepping away from the numerical patterns and all that stuff as to like why it happens in general. I'm reading from Michael's reporting here. 20 states described expanded access to behavioral and mental health services as a necessary intervention, but that number was considered low by several children's advocates. And I'm going to quote him, quoting Maggie Carlson, who's an attorney in Oregon with Youth Rights and Justice. This is what Maggie told Michael. Improving and streamlining access to mental health services and therapeutic support is the most critical piece of addressing this crisis. For the children I have worked with, access to the appropriate level of therapeutic services in a timely manner has been the most challenging obstacle to stabilization. All right, we'll take a quick break and be back with a few more child welfare headlines.
Are you a professional in the field of child welfare, juvenile justice, or other family and youth services? Subscribe today to Youth Services Insider, the imprint's exclusive section on all the insider news you need to stay in the know. Funding opportunities, major federal and state policy shifts, interviews with key leaders in the field. It's all available only for our Youth Services Insider subscribers. Sign up for a monthly or yearly subscription today by visiting imprintnews.org/subscribe. Our podcast listeners get 10% off their subscription by entering the promo code PODCAST10. That's imprintnews.org/subscribe and get 10% off your subscription by entering the promo code PODCAST10 today.
All right, let's do a few more headlines. I'm going to start by ticking through a few interesting money stories. As I mentioned a couple episodes ago, it really does feel like we are starting to see the collateral effects in budget decisions and spending decisions on the state level that are what I would say is collateral effects of big structural changes, like the looming changes to Medicaid and the already in place changes to SNAP and food stamps. And then the end of the COVID era emergency funds, which I think the Medicaid and SNAP gets a lot of attention, but I actually do low-key think a lot of like what we're seeing now might really be related to the surge in COVID era funding going away. So here's just a smattering of ones that are not all related or the same kind of theme, but I think all speak to a stress in the system around available resources. So the first one is from the Miami Herald. And let me just say before I start all this, I will drop a link in the show notes for all the stories that I'm going to kind of rip through here. And you can read a little bit more about them if you'd like. I'm just going to kind of quickly summarize kind of what's going on as I see it. Story one from the Miami Herald is about the Young Parents Project, which is a home visiting program designed specifically for pregnant and parenting youth in foster care. And we know that's a very vulnerable population who are at much higher elevated risk of losing their kids to foster care because they are already in the system. And in the story, you learn that Citrus Health Network, which is the lead agency that oversees Miami-Dade County and its child welfare system, for people not from Florida that don't know, Florida is fully privatized. So they have these lead agencies that run, big swaths of the state. So they have been partnering on that program for 5 years, eliminated the contract. It's about a $580,000 contract to help address a budget deficit. So that's a pretty straight on example of just cost cutting at this point. Two stories out of Ohio that really speak to sort of the economics of things. So in Hamilton County, which is where Cincinnati is, there is going to be a property tax levy that would raise the rate by 38% on the ballot in November. And this is pretty much entirely attributable to the rising cost of children's services in the county. So the county's Department of Job and Family Services has seen their out-of-home care costs rise by 92% since the last time they assessed the levy. And the number of kids, though, so a 92% increase in cost since the last levy in the county, the number of kids in foster care is up 19%, and the placement costs are up 90%. So I think I want to highlight that one because this is a situation where, yes, there a 19% increase in the number of kids in foster care is nothing to sneeze at and runs counter to the overall trend in the country. They are proposing a 38% increase on people's property taxes and not even projecting that to cover the entire deficit. So they will have to either cut costs or find other ways to increase resources. And this is becoming like an issue across Ohio, the rising cost of foster care in the county. I'll get to the other story in a second, which sort of also relates to that. But I just wanted to also highlight the last time I was in Ohio, I was at a conference there, and a lot of advocates for children and families were extremely concerned about the potential passage of essentially an end to property taxes in the state, which is now, in retrospect, actually like insane to think about what the impact of something like that had been in a system that now is relying on jacking up people's property taxes just to not be able to afford the cost of foster care as it is. And then the second one that's related, maybe some folks who listen to this podcast have heard of this really tragic story out of Vinton County in Ohio, where they pulled 16 kids of various ages out of a home. The kids were in horrendous shape. Some of them had to be medevaced and intubated afterwards. These kids had very basically not been educated. And there's some details coming up. They had been investigated by another county at one point. But as I'm actually bringing this up today, not to highlight that, but the fact that there are some Ohio lawmakers who are using this case as a pretext to cap the amount of money that any foster parent or foster care provider could draw per day for any one child. And here's a quote from Representative Justin Pizzulli, who is one of the lawmakers pushing this. "What we are facing is an unsolvable math problem," he said, citing the $1 million the state had to send to a multi-county agency just to handle the 16 kids that were taken out of the Siders home. This is the story I was talking about. And then Representative Darnell Brewer, who's a Democrat representing Cleveland, is also in on this bill and framed it as setting reasonable guardrails and not barriers to accessing care. But both of these reckon in different ways with the situation right now in Ohio, where they just do not have the resources to handle the more so than an increase in kids, I would say just a rise in how much it costs to take care of any of them. These two might be somewhat unique to Ohio because Ohio does push more of the cost for child welfare onto counties than any state, right? They just have very little state money allocated to child welfare. It's much more of a combination of federal and county, but I do think it's indicative of a broader increasing drive by lawmakers to rein in costs of governing just in various ways that didn't exist before this crunch in between the withdrawal of COVID money and the looming and present day cuts to big federal spending. From the outlet West Virginia Watch, some reporting on lawmakers who are angry at Governor Patrick Morrisey over the state's fairly opaque use of the federal program called TANF, Temporary Assistance for Needy Families. Now, this popped up as a result in part of a recent delay in school clothing vouchers that was announced by the governor, that those vouchers were paid for by TANF. And then an announcement earlier in the year, in the summer, I think it was in May, by the governor, after the budget had been worked out, after the state had already finalized a budget, he announced that the state was projecting a deficit in TANF-funded work. And I'm going to quote from the story here, which the state uses to pay for its child care subsidy program, foster care, and other programs helping low-income children and families. So the situation is that West Virginia has about $98 million to use in TANF, but they have $137 million in expenses funded by those federal dollars. So they have clearly, while the lawmakers are saying there's some murkiness about what they're spending TANF on, they're clearly, I think when you think about TANF and why the program has shifted away from actually just providing cash to low-income families into spending on state and local programs to help families, this is a solid example of why they have, I'm reading the tea leaves here, but kind of seems like something that happened here is similar to Ohio. The cost of everything has gone up. They are on the hook to produce these programs and execute these programs, and they don't have enough money to do it anymore. So think about the likelihood of West Virginia moving TANF back towards just helping households with cash when they're at a point where they've aligned programs, foster care, child care programs, around spending TANF dollars on it and not even having enough to do it. Last one on this sort of money watch here. This is out of Louisiana. At a recent Senate Select Committee on Women and Children, foster parents pretty much teed off on the state's Department of Children and Family Services in a year following an actual 50% increase in the monthly rate that foster parents receive. So they got a 50% bump in the monthly amount of money that foster parents are provided, and were at the committee to excoriate DCFS. And I'll tell you the reason why is because while implementing this raise, which took it from $600 a month to $900 a month, DCFS, without any legislative action, it seems like from the reporting that I will link to, removed a reimbursement process for foster parents. So previous to this raise, they were getting $600 a month just as a steady board payment, but it could also get reimbursed for things like gas and mileage, which can add up, especially if you have a kid. Let's say you are in Louisiana and you're in one parish and the kid is coming from a parish that's an hour away. You may need to be driving back and forth to doctor's appointments, things like that. Now, the current system is that there is a $900 monthly payment, but no reimbursement program. And one parent at this committee hearing said that her estimate was that the net effect of that for her family would be a $6,500 loss relatively to previous years. So I just like in doing the back of the envelope math on that. That means, I think, because the $300 per month increase works out to $3,600 more in monthly payments. That means she was getting reimbursed for at least $10,000 in expenses every year above the $7,200 drawn through the board payment. And lawmakers were really pissed and perturbed by DCFS acting in this way and getting rid of the reimbursements on its own in this regard. Just another one where I think it's revealing all of these stories that I just listed. I think if I had to draw a through line between them, it's like there are expected costs beyond what's on paper in formal policy, things like monthly payments to foster parents that go into executing a child welfare system, especially when it's a big one. And this wasn't getting a lot of attention. And in this current context where the economy's not great, you've got the emergency bazooka of dollars that went into the social safety net during COVID drying out from the system. And you have states contemplating what's going to happen when are we going to cut Medicaid, or are we going to try and backfill the losses from federal limitations? What's going to happen with our food stamps? Are we about to get clobbered with penalties over that? People are starting to notice. And I think that this is the first year in which there's going to be some pretty serious belt tightening and some very hard decisions made about what we're spending money on when it comes to child welfare and youth justice as well. Well, that doesn't get as much attention. And next year will be, in my estimation, will be the toughest one. So actually, the discussions around budgeting that come up starting in January, I really think that's something you got to pay attention to. All right, I'm just going to close on a couple of quick hits about interesting legal challenges and court decisions of note. One took place in Maine, where the Supreme Judicial Court vacated a termination of parental rights that involved a mother from New Mexico who had been traveling in Maine with her child, had her child taken very briefly into foster care pursuant to an investigation by Maine while she was there. She went back to New Mexico and was on a case plan by Maine's child welfare agency. So she's in New Mexico, but she is living up to, and this is all according to the reporting on this from the Maine Monitor, she was living up to and complying with her safety plan and everything that Maine was asking her to do, except one thing, which was they were requiring her as part of the case plan to relocate and move to Maine. And she had a housing voucher. She had stable housing available to her in New Mexico. She did not have that in Maine and basically was not in a position to say yes to that. So Maine sought a removal of her child in foster care as a result of her failing to comply with that. And the Maine Judicial Court here basically just shut that down and said that's not an appropriate use of compliance or supervision by the state's child welfare agency. And then the other one is in New York, where the imprint's Sushanti Sarkar reported on a recent decision that New York City's child welfare agency made an unlawful decision to continue monitoring a mother from the Bronx who had been subjected to domestic violence well after the initial investigation had been concluded. And so what happened here is the mother had reported domestic abuse by the father of her 3 kids. That led to an investigation of him, which led to a neglect petition against him, and he was banned from having unsupervised visits. But then also at the same time, ACS was granted permission by the family court to continue supervising the mom, even though everybody agreed she hadn't done anything wrong. She had just been the victim of domestic abuse. But they got permission to supervise her even after she had left the state. She moved her and her 3 kids to Florida, and they continued to supervise her for 9 months. So this case is really dealing with the sort of ability to stay in the lives of people, parents in particular, who have not done anything wrong and really have no reason to be the focus of systematic supervision like that. Reading just from the court's opinion that Sushante included, we once again find that ACS's policy of pursuing supervision in such cases reinforces the coercive control underpinning abusive relationships, turns survivors into suspects, and requires the non-respondent parent to answer for the respondent parent's abusive behaviors. All right, that is going to do it for us. Everybody have a good end of August. Enjoy the Labor Day weekend. We'll see you back here in September. The Imprint Weekly Podcast is a production of the SafeCamp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at SafeCamp Audio on all major social media. This podcast is produced and mixed by Christine Onjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you would consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. We would greatly appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow, cover more great stories in child welfare and youth justice. To support us, it is very easy. You just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews, and you can visit us on the web at imprintnews.org. You can get us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.